In 2017, African American women gave birth to 23% of babies in New York City, yet accounted for 55% of maternal deaths. Overall, African American women are 8 times more likely to die from a pregnancy-related cause than white women. The report includes a number of recommendations to address these inequities.
And joining us to discuss these potential solutions is New York City Public Advocate Jumaane Williams. Jumaane, thanks so much for joining us today.
Thanks so much for having me, and more importantly, thank you for keeping this information and story going.
Well, we appreciate you all sharing your story with us as well, because it means so much and impacts so many people. So as far as these recommendations go that we're talking about, what would you say at this point is the first and most immediate thing that needs to happen?
Well, one, we have to just keep talking about it. I'm not sure which is worse, the statistics that you just gave, or the fact that everybody knows them and is not doing much about it. So we want to make sure the story continues to get elevated. Here on the city level, we have some bills in the city council that we're hoping will get passed that will get a maternal bill of rights, to name a few things. On the state level, we want to make sure that doulas and midwifery is covered by insurances. And we want to get training for people who just need to understand the unconscious bias that comes along with so many sectors, and the medical field is no different. And on the federal level, we 100% are supporting the Momnibus Act.
And Jumaane, you touched on some of them, but what about the longer term solutions here? What do those look like?
It really is making sure that there is funding and resources going into the places and the communities that, one, just have to be educated about what their rights actually are. And two, some people who actually know those rights, like my wife, still have to deal with unconscious bias in the sector itself. And so we have to get funding into getting training and changes into how these services are being provided. And we have to make structural changes within the system, like having doulas and midwiferys covered, like having a patient's bill of rights so people can understand fully what their rights are and what they can demand. And we have to get changes in the H&H, which is the city, and how they deliver these services.
So, Jumaane, we know your report also calls on Congress to pass and the president to sign the Black Maternal Health Momnibus Act. Right now, maternal health equity is part of the Build Back Better framework. Are you optimistic it's going to stay in the bill?
You know, I think a lot of people are concerned as we move forward because things keep dropping off. I am thankful that Senator Schumer is pushing to make sure it stays in. And I really hope it does, because when you see the disparity, it's unconscionable that that disparity exists in 2021. It's even worse that people are just allowing it to happen. And you should not be figuring out whether someone's child is going to live or die, or a mom, a birthing person is going to live or die simply because of their race. But that's exactly what's happening. I would say it's not necessarily a whole bunch of folks who are specifically intentionally making these decisions. There may be people who have these things on their mind, but more than likely it's people who are dealing with unconscious bias. Unless we really go at the heart of that, we're not going to get the changes we need.
Yeah, that undue stress it is putting on moms. New York City Public Advocate Jumaane Williams, thank you so much for being with us. And again, thank you to you and your wife, India, for sharing your deeply personal story with us and being a voice for so many people. We appreciate you.
Thank you.